Welcome to Therapy Facts with Dr. Jenn. We are talking about the therapy facts gleaned from the interview between Shannon Sharp and Monique on the couch at Club Shay Shay. So, wow, what a conversation, what an interview. Point number 5 deals with the ceasing of the transmission of intergenerational trauma. Monique talks about being so concerned about advocating for herself and holding people accountable, knowing her worth, having her voice, so that she can make sure that people coming behind her on the same pathway are not subject to the same traumatic experiences. That is a word, because most of the time when people have experienced trauma along a journey, they stand by and watch someone else experience the same trauma on the same journey, because they say to themselves, well, that's a part of paying dues. That is just what you have to put up with. Well, guess what? Monique is calling BS on that. And she is saying that we need to advocate for ourselves and ensure that we are being treated fairly according to standards that have already been set by whatever the circumstance we're in. She does not say that dues should not be paid, but of course, the dues should come with whatever benefits that were worked for. So, for example, she talked about, again, her Netflix special and being treated fairly for who Netflix deemed her to be based on her portfolio. She did that so that the next person who looks like her, who is ready for a Netflix special, will be more likely to be treated fairly. She talks loudly and openly about steps to take in the journey, questions to ask, and circumstances to request, so that people coming behind her will know what to ask for, will know what to request, and to know how to be treated fairly. To those people who said to her, hey, I could have given you that information, but I didn't. Again, she cries BS and says, well, guess what? The people coming behind me won't have to ask me. And they certainly won't have to say, hey, I could have told you, because she is putting it all out here for public consumption. So people coming to therapy and really trying to find their voice and figure out how to use their voice don't often consider that other people have been put in the same circumstance that they have. Many times when people are talking about, for example, a bad supervisor at work, and they feel so victimized and they feel so singled out, and I make a statement about, hey, have you asked around to see if other people have had similar circumstances or if other people have made complaints about them? And very often, by simply doing a little bit of research, people find out that in fact that person is known as a bad boss and they have plenty of complaints against them. And so then that person who is in my therapy chair realizes that, hey, there's not something uniquely horrible about me that makes this person treat me this way. In fact, this person is a bad actor. And certainly, sure enough, that bad actor is still in that setting. And so very often, bad actors are allowed to remain in settings in order to victimize, and they end up victimizing other people, perhaps because people don't consider that the behavior isn't going to stop in this particular circumstance. And so one of the reasons for speaking up and speaking out is stopping that continuous transmission of that trauma. When we leave it up to default human behavior, we are going to keep doing the same negative behaviors, making the same mistakes over and over again. However, when we are intentional, we find our voice, we know how to advocate for ourselves. Not only can we free ourselves, but much more significantly, or even as significantly, we can free the people coming behind us. That is a big, big deal. And again, Monique is a great live out loud example of being able to speak up in order to cease the transmission of trauma to the next generation.